You might actually have these mites living on your face and your eyelids right now. But don't worry, this is actually considered normal or common. But if they get overgrown, overpopulated, they are linked to a few issues: rosacea, puffy eyelids, styes, and big ones, blepharitis and dry eyes. So the question is, do you have these, and what are the best treatments available right now to get rid of them? Let's focus in. These mites are called Demodex, and there are actually 65 different species of these mites, but there are two that actually live on your face and your eyelids: Demodex folliculorum and Demodex brevis. And they actually live in your hair follicles and sebaceous glands, oil glands. And like I said, it's actually pretty common. By the age of 45, 3 out of 4 people actually have Demodex mites living on them. And that number only gets larger as you get older, reaching 100%, where everybody at a certain age actually has Demodex. They actually feed off of your oil and hair follicles, and between the remains and waste and the debris that they create, it causes all of these issues. Now, these mites are tiny. They're microscopic. We can't see them with our naked eye. In fact, we can't see them with the slit lamp microscope in the clinic. We can see signs of the Demodex, but we can't see the actual Demodex. Some doctors will actually take a sample of an eyelash and look under a high-powered microscope to see the Demodex there. And specifically talking around the eyes and eyelids, they cause Demodex blepharitis. Now, I did a whole video talking about blepharitis, bacterial blepharitis, but I want to do a specific video about Demodex blepharitis just because it can be pretty common and the signs are pretty specific. This actually can create what they call collarettes around the eyelashes, or cylindrical dandruff. And when we actually have a patient look down or close their eyes, we examine their eyelashes, the base of their eyelashes, for these collarettes. And it actually looks like a waxy buildup at the base of the eyelashes, kind of like a candle with a wick coming out of it. And these collarettes are caused by the Demodex mites living inside the hair follicles, eating the hair follicle and scratching deeper into the follicle, leaving debris of skin, and all that buildup gets pushed out with the hair follicle as it grows. And then all that debris creates a perfect environment for fungi and toxins, and that's where it creates all of these symptoms of blepharitis. If we see this type of presentation, it's a pretty confident diagnosis that that patient has Demodex blepharitis. And this can cause a lot of similar symptoms to normal blepharitis: inflammation of the eyelids, mattering along the eyelashes. It can cause dry eyes, issues with the oil glands, the meibomian glands. It can cause red eyes, conjunctivitis, foreign body sensation. Dry eyes is a big issue. And recent studies are showing that people that have blepharitis, 7 out of 10 of those patients, that blepharitis is caused by Demodex. But what makes it extra tricky to treat Demodex is that the mites actually have a short life cycle, 2 weeks, 14 to 18 days, and only 5 of those days is actually spent as an adult. So now if it's a chance that you have this, what treatments are the best to get rid of them? First one that a lot of people talk about, and that falls under the eyelid hygiene category, and that's using tea tree oil. Tea tree oil has actually been the go-to for many years to treat Demodex blepharitis. There are many studies that have shown tea tree oil has been great at reducing the population of Demodex, can actually eradicate a lot of Demodex. And there are many different products, eyelid wipes, eyelid cleansers, that have certain diluted tea tree oil percentages in them to help with that Demodex blepharitis. These are some of the eyelid wipes that I've used myself and my patients have used with great success. Some eyelid cleansers as well, and I'll put these links in the description if you want to check those out. I really do think they can actually work really well. Now, 2 things to note here. Number 1, you do want to pay attention to the concentration of the tea tree oil. Higher concentrations, and when I say higher concentration, we're talking 5% or above, can have an irritation effect on the skin, kind of a burning, a stinging. And I'm a little bit sensitive to the tea tree oil, so I've experienced that myself, so I do better with a little bit lower concentrations, but that's something to be aware of. Number 2, there is a lot of questions surrounding tea tree oil and if it can actually harm or damage the meibomian glands. That came from a study that showed and tested it with a higher concentration exposed to the oil glands over a long period of time in vitro, so in a petri dish. And in the real world, we're using a much lower concentration and we're washing the cleanser off our face so it's not sitting on those oil glands for a long period of time. And so it's kind of a take it with a grain of salt, that study. So a lot of doctors really aren't worried that much about it, but it's enough to be in the conversation. Another option, also in the category of eyelid hygiene and natural product, is Manuka honey. I actually did a whole video about Manuka honey, eye drops and gel forms that can actually help with blepharitis and dry eyes. Worked really well for me. I still like it and still recommend it to a lot of my patients. Also, studies have been shown that it can have a benefit at reducing the population of Demodex as well, and so it can help with that Demodex blepharitis. There is a cleanser that I think has worked the best for me that has Manuka honey, coconut oil, aloe vera in there, MyboClean. Again, I'll link it in the description so you can check it out, but if you're looking for an eyelid cleanser that might have that in there, that's a really great option. Now, there are some in-office treatments, meaning that you can go into a clinic and they actually can do treatments on those eyelids and eyelashes that can help with Demodex blepharitis. One popular mode of treatment is a microexfoliation or a mechanical exfoliation. They can use a tool or a cleanser and actually remove a lot of that debris and cylindrical dandruff, collarettes, to try and clean those eyelids and eyelashes. And a lot of studies have shown if you use this in combination of using tea tree oil at home, can actually work really well at reducing and eradicating that Demodex blepharitis. Another in-office treatment very popular for dry eyes, and that's the use of IPL, or intense pulsed light. IPL has been shown to completely eradicate and remove Demodex mites. And IPL is also a great option for people that have rosacea and dilated blood vessels. And so if you have a patient that has ocular rosacea, as well as Demodex blepharitis or signs of Demodex, IPL can be a great option. The downside to IPL is that it can run expensive, especially if you're doing bundle sessions, usually 3 to 4 sessions, which is usually what's recommended. Usually insurance doesn't cover this, and so it can be an expensive in-office treatment. Now, moving into prescription options, one option is ivermectin ointment, a 1% ointment that you can actually rub on your eyelids. A study in 2022 showed that using ivermectin ointment once a week for 15 minutes in conjunction with your eyelid hygiene throughout the week did show a significant reduction in Demodex and actually could work really well. So this is an option that could work for some people that have trouble getting rid of those Demodex using eyelid hygiene products or in-office treatments. And probably the newest medication out that came out in 2023 is an eye drop called Xdemvy. The medication is lotilaner 0.25%, and it's actually a 6-week course using the eye drop twice a day. And this has become an excellent option, an excellent medication for people that really want to get rid of the Demodex blepharitis, for that stubborn Demodex that might be tricky to get rid of. And the reason for the 6 weeks, because of that short 2-week life cycle, you actually catch multiple populations, multiple generations of the Demodex. And it works by paralyzing the mite so that it actually can't move and eventually dies off. Now, because Xdemvy is considered a newer drop, there is a game with the insurance, at least here in the United States. Some insurances, if you're lucky, you can actually get a copay of maybe $50 or less. If you don't have insurance or you're not lucky, it can be an expensive drop. It can be upwards of $800 to $1,000. Now, a lot of people are lucky enough that they can have that copay where it doesn't cost as much, but it can be an expensive drop. One thing that we found doesn't work is actually hypochlorous acid solution. Now, hypochlorous acid solution can work in bacterial blepharitis, normal blepharitis, but they've shown hypochlorous acid does not work for Demodex blepharitis. So if you have blepharitis and you're using hypochlorous acid solution and it's not going away, there's a good chance that it could be Demodex. So question for you, have you experienced Demodex blepharitis, and what was the best way that you got rid of it? What was the best treatment for you? Leave it in the comments. If you want to learn more about bacterial blepharitis, I'll put my video right here so you can learn more, or more dry eye videos right there. I'm Dr. Neil Guymon, Dr. Eye Guy. Stay focused.